Well, welcome everybody. I know we're in 4 different places. Three of us are in the state of Florida, and then Mr. Geoff Botak, who has been kind enough to join us, is in Philadelphia. And so, again, as we've evolved with Zoom communications, it's just amazing to be able to have somebody like you and sit down and have this conversation with the three of us. So, Geoff, I appreciate you hopping on here, and ultimately, I know your relationship with us and your relationship with Rod goes back a ways. And ultimately, Rod, I wanted to kick it to you to really do the service of highlighting Geoff's story or a portion of it, and ultimately how you guys got to know each other. And then we'll really get into the guts of what Geoff's doing right now.
Yeah, man, it'll be my pleasure, Geoff. Certainly, we're honored to have you as a guest here, man. And as Taylor said, our relationship goes back to, I think it's 2011, mid 2011. I was working for a medical group out of Orlando in the behavioral space. It was a kind of a niche concept where we shared, we brought primary care medical services into behavioral hospitals. Shortly after I joined forces with that company, I was introduced indirectly to you, Geoff. And the abridged version is I was welcomed to share our concept. Geoff had an idea of what we were talking about from a brief phone conversation, but knowing that I knew very little about the workings of the behavioral model, I was pretty familiar with the primary care concept coming into the facilities. And Geoff welcomed me in, ultimately welcomed our company in. We had a very nice business relationship that shortly after kind of blossomed into a friendship. We've shared some commonalities with our kids and just kind of where we've come from. And Geoff's story is really amazing to me because, Geoff, you started out as a nurse. Your path was pretty impressive. You've always been passionate about patient care, I know, and you've always been just a natural born leader as far as my assessment goes. But that operation that I was able to see was you in a position leading, I believe, 12 or 15 hospitals. I may have the number a little bit wrong, but they were behavioral hospitals, all large behavioral hospitals. And it seemed like one by one, you continued to bring us in to help provide those services and really take a challenge that you guys had, which was providing primary care and allowing us to partner with you that way. And ultimately, you and I building a relationship. I know that role in particular, you managed, I believe, almost $1.5 billion of revenue. Which is amazing to me. Fortune 500 company, to those of you that are listening, Universal Health Services, the behavioral division, and really, were and continue to be a leader in that space. I know that everybody knows who you are, the way you craft a team, the way you lead an organization, and the way that your hospitals perform. As an outsider in the beginning and now having a pretty good reference point of what those look like to run well, just have all the respect in the world for you, man. And I just couldn't be more happy that you're on a guest on our podcast. And fast forward to today, I know you're excited about the opportunities that you've taken on, I think about 2 years ago now, leading a little bit smaller organization, but big plans, big strategies to move that service and that organization into a new stratosphere, really. So yeah, if you want to catch us up, Geoff, and the fun part for me in kind of getting this conversation kicked off, and what I continually am super respectful of and impressed by is the fact that your teams that you were with back in the day when I worked with you in the hospitals to your teams now, they just have the most respect. They love being led by you. They all have just this incredible loyalty, and you don't have to be within 10 feet of you to hear that from everybody that works with you. So maybe just catch us up real quick on kind of what your timeline has looked like and what brought you to where you are now. That'd be great before we jump into the guts of what leading through adversity really means.
Sure. So Ron, I just want to thank you for that. That was that's nice to hear your perception of the relationship and how we started together. And Taylor and Brett, thanks for having me on. So yeah, I did start out as a nurse, a detox nurse, in a drug and alcohol center, and just outside of Philadelphia, with one of the Universal facilities, and learned a ton, and became real passionate about taking care of patients. And I think what I learned over time and what evolved for me was I had a pull, I think, to impact initially patient care in a bigger way, which led me into some leadership positions at a department head level. And so I got to learn a little bit more about the workings of a behavioral health facility. I did utilization review, I did risk management, I was a director of admissions. And so I shifted from one-to-one, face-to-face patient care to impacting a department that sees multiple patients and multiple staff that took care of patients. And that kind of grew for me. And I think that's really what sort of ignited my desire and my ambition to grow. And so ultimately I became the CEO of that facility. And it was a facility that was in trouble, actually. We had sort of a carousel of CEOs that came in and didn't make it. And I think the foundation of my leadership philosophy was really born there, which is really born in a spirit of service. And you kept saying the word team, and that's really what it comes down to from my perspective is team. And so actually some of the folks that work with me today, actually two key members of my senior leadership team were peers of mine going back into the early 90s. And so I'm blessed and honored to have that sense of loyalty with these guys that have come to work with me. I've learned as much from them as they've learned from me. Talking about learning to lead through adversity, we certainly had our share of adversity, back then in that facility. And so we were successful. I was there for 4 years as a CEO. Based on the success there, I was promoted to a newer acquisition that Universal did. The great thing about Universal, great company, have a lot of respect, had 27 unbelievable years there. Was that we grew. And so we acquired facilities, and that allowed me to take on new cultures, facilities that were maybe challenged and in trouble and facing their own adversity. And I think out of that came the cornerstone of really what I think I was successful at, which is I became a turnaround specialist. And so I took on a new facility that was acquired by Universal that was in trouble. Staff morale was very low, huge amount of turnover. They had multiple CEOs, again, with a lot of turnover in the senior leadership, a facility that was strategically in trouble, although it should have been strong. It just was not doing as well as it should have been. And I was there for 4 years as a CEO and was able to turn it around. So things like how we measure it is, patient satisfaction. We went from last to first out of about that time 80 hospitals. Wow. Employee satisfaction, we went to top 10. Wow. Financially, all the financial indicators, we improved dramatically. And so I was lucky enough to be part of that. And I say I was the CEO of the facility. I was certainly just part of it. It was a vision that was created with the team. And I'm a big believer in shared vision. And so I think I started to kind of elevate and grow in my leadership philosophy, certainly at that facility, while I was there, was promoted into a multi-facility leadership. And so I took on one small facility in 2006, I think it was, and then multiple other facilities between 6 and 10. I think, Rod, when we met, maybe I did have about 10 to 12 facilities. And at the end, when I left, I think I had about 35 facilities in about 10 states.
I remember,
Wow.
I remember that number 35, and I think another kind of pod had moved up into the Chicagoland area, if I'm not mistaken.
Yes. So I took on Chicago and Atlanta for a brief period, and a lot in the Midwest. And so, I just learned so much, and what I learned is, that there are pillars of success in a behavioral health facility. And, there's a few things that you really, really need to focus on. But what I think I focused on the most was the people and the people processes. And I saw it as I can take care and touch more lives through people than I can through just individual interventions and or communication with patients. And so that really became the cornerstone of what I believe and what I still believe to this day. I left UHS in 2017. Really more personal reasons than anything else. Tough to get on a plane every Monday and come home every Thursday kind of thing. But I took on a smaller company. It was a challenged company, but again, had strength, just a lot of turnover. And I'm at Malvern Health now. And we've been at it for about 2 years, built my team, and facing adversity, adversity in our core business, but also obviously adversity now with what's COVID's going and the impact of COVID. I feel like in a lot of ways that the turnaround challenges that I faced in the facilities that I took over has sort of helped me get to a place where we can face this in a positive way. And overcome the challenge and the obstacles and the barriers that it's presenting for us, helping people. We're facing two epidemics, an opiate epidemic, an addictions epidemic, and a pandemic, at the same time. And so I can't recall any other time where it's been as challenging as it is right now. But it's great to be part of a team that's rising to the occasion.
You guys are almost ground zero for the opioid epidemic as well, right? I mean, Philadelphia is a hard hit area, and specifically South Philly, not far from one of your flagship programs. I know is basically right there.
Yeah. So in my mind, as a detox nurse and in admissions, I was bringing patients in the early 90s, 93, 94, 95. Heroin was the drug of choice in Philadelphia. It dominated the street back then. What's different now is that they cut it with this fentanyl, and it's lethal. But the overdose factor back in the mid 90s, they would cut it with scopolamine, and you would have little spurts of overdoses. I think Episcopal Hospital, which is a hospital in North Philadelphia, hit national news in 95 for 20 overdoses in one day. And so It's been here, but what's different is the lethality of the fentanyl and the science behind some of the street drugs that we're seeing, and how it's impacting these younger kids and people that are using the drugs. It's really, really scary.
A couple things you referenced, Geoff, that and I'm writing. I mean, we could be taking notes during this. You mentioned your pull towards servant leadership. That is such a strong word. It's a word that Brett and Taylor and I hold close. We believe in serving. We believe in serving each other. We believe in serving our teams. We certainly believe in serving our clients. It served us well, if you will. I know that I'd love to hear a little bit more about your viewpoint and how your teams, especially through tough situations, tough realities of the opioid epidemic and the COVID pandemic, how that servant leadership serves you, serves your teams. And then the other thing you said that I'd love to just kind of touch on is your idea of shared vision. I take that to mean a shared vision creating a win-win. Can you talk to us a little bit about those two things?
Sure. So, in terms of servant leadership, I think it grew out of my desire to impact more patients, simply. And through that, I started to really recognize people that shared my desire to make an impact with people and with patients. And I came to really, really appreciate, one, the desire, but two, the talent and the commitment and the willing to grow and the willing to look at themselves and the self-awareness it takes to, I think, be successful. We work in a high burnout industry. And so I have a lot of respect for people that have the staying power and the ability to stay positive and a good attitude is so critical. But so what it's grown for me over the years is I've come to appreciate the interaction I have with a staff member that I watch hired on as a social work line staff person on a unit that grew to be a CEO and a leader of her own facility, or somebody that started out as a marketing person who now is a regional marketing person across the country. And that to me is as meaningful as it is to watch somebody recover from drugs and alcohol. And so it really is a feeling in my heart that the staff have become as important to me as the patients in a lot of respect, because they are who I can touch patients through. Now, that doesn't mean that we don't have a culture of accountability. We do, it's absolutely critical. It actually makes a culture of accountability easier, because you create teams that don't allow for people to not do the right thing. And so it's just become something that permeates a facility over time, and it's not something you can just come in and just turn on. You have to grow that over a period of time. But to me, that's servant leadership, and that's the real true benefit that you get from adopting that at your core. It's not something, from my perspective, that you can fake. And you see people try and fake it, and
absolutely,
people see right through that. And I've also, a lot of people that I've seen in leadership positions, and even peers that I've had, they have a mentality of, everybody's replaceable, and I definitely couldn't disagree with that more. Now it doesn't mean I haven't had great people that have moved on throughout my career. Luckily, I can count on a couple hands. At the end, I had 15,000 employees. It's going to happen.
Wow.
But when it did, it was something that was probably one of the more meaningful things that happened to me. I was able to come back, kind of take a look inside and say, all right, did I miss something here? Was there a missed opportunity for me to do better? And then sometimes it's just because people get great opportunities, and I'm happy for them, But I think that's what it has to be able to really truly be a servant leader. You have to come from that place.
It's crazy to hear you say that, because I see that I saw that in your character early on in our relationship, and it still rings true today. Like I said, when I sort of introduced you there, it's to watch your team respond to your leadership and know they're empowered, and know that as you say, the shared vision exists. I mean, as I work closely with most of the people that are department heads, I guess you'd refer to them, for you now. And I mean, it's the message is just always so consistent. I feel like every time I'm talking to them, I'm talking to you. So it's really, really neat to see. It's really neat to see that.
That's great to hear. And I can tell you that I've learned as much from them as they have from me over the years, and I continue to, which is great. One of the things we have our top 15 leaders have an average of 16.6 years of experience. And I just did that little exercise here before I did this, just to kind of get a feel for it. I knew we were a very experienced team, but one of the challenges is keeping us from getting comfortable with that, and how do we continue to press, and how do we continue to learn, and how do we continue to raise the bar and raise the expectations. And so it's great to hear that we share that, that kind of same communication, same vision, same language, but now how do we take that to the next level?
What was that? You said 15, your top 15 leaders have 15 to 16 years of experience.
Yeah. 16.6 years experience.
So that's about 250 years of experience between you and your top leadership team. I mean, that's pretty impressive right there. That quantifies my statements and my comments. Brett, tell you, what do you think about that?
Yeah, I wrote down here. You said, "Are you taking notes?" And my answer is absolutely. I'm taking notes. Anytime Geoff talks, I'm always taking notes. I was just going to ask you, just if I'm listening to this podcast, or even for me personally, I just think about, how valuable, number one, is it is a true test to just your leadership to be able to attract those same individuals that have come to work with you and continue to sing your praises over the years, and to have that many. The proof is in the pudding. So that's super impressive. But how valuable has it been to have, those key leaders on your team, especially during, this COVID situation coming about? Is it something to where you have, obviously it's strategic, but did you undervalue it? Did you, is it something that maybe you overvalued? Has it been a conversation that you guys have had? How big of a deal has that been during this COVID situation?
It's been bigger than I could have imagined. And I'm not somebody that undervalues the importance of individual talent and team in a crisis. I just never really envisioned this type of crisis. In behavioral health, we experience clinical challenges, staffing challenges, regulatory challenges, incidents that occur in the physical plant. There's a lot of different variables that we have to be prepared for. And I had a breakout of the flu in a facility. On occasion, you might get hepatitis or something like that that occurs. Never anything to this scale. And so I would say that Montgomery County in Pennsylvania was one of the first counties in the country to close. And I think it was in early March. In February, we were working to be proactive. I think that was, and I go back and I look at that, and we look at the documentation around how we were starting to look at our infection control practice and everything else. I'm really proud of that. It's something that I would have expected from the team that we have. To see it escalate to where it did, where we have an actual shutdown and a quarantine situation, basically in our community. And now we're admitting drug and alcohol patients into a building that is designed for community therapeutic milieu, and to keep people safe in that environment it was a challenge that we didn't necessarily anticipate. And to see the team respond the way that they did, and to get the results that we have gotten is something that I am very proud of, and I'm in awe of several members of our team who have really, really taken the lead. And so it was more important than I ever thought, and I'm somebody that understands how important individual performance is in a crisis.
Geoff, real quick, Brett, I want a quick follow-up to that, because Geoff, to Brett's question and directly to your answer, your outcomes through this have been way outside the norm from other big facilities all around you. Am I accurate in that statement?
I think there's been a lot of facilities that have performed very well. I would say that there have been some that I know of in the market that have really struggled and maybe didn't take it as seriously, and they paid a price for it, a pretty significant price. We and I count this as somewhat somewhat luck, but we have not had a case that we're aware of. We've had some significant challenges with testing in the market, but we have not had a case in either of our 2 residential settings.
Wow.
The other thing that I'm incredibly proud of, we have 3,500 outpatients and school-age kids that we saw in schools, and we converted to telehealth within a week. And that was
Yes.
a massive, massive undertaking that the team did. Just an amazing. These are people that are used to doing service delivery face-to-face in a school, and now we're doing it, over pads.
Right.
And so I think that there's a lot that we can be proud of, and I think that we count ourselves as lucky. And I think preparation and luck, that old saying, but we're not out of the woods, and we know we're not out of the woods, and we're not letting our guard down. Our message today is there's a lull before the storm. The fall is coming, the flu season is coming. We need to stay prepared. We have frontline staff that are dealing with this every single day. How can we support them? How can we help them through this? That we have to protect them. We have to protect their families, and ultimately we have to protect our patients.
I had a question to follow up on that, Geoff. That's a great answer. How important has speed been during this process with all this information that's coming at you, and you have all these different facilities, staff, departments, so many moving pieces, to execute some of this stuff in a normal setting, you would think takes some time, but it seems as if everything has happened so quickly. For you to be ahead of this stuff requires a certain level of quickness, and how has that come into play, and has that been part of your conversations, especially when dealing with like a crisis like of this magnitude?
I think partially comes down to role and function within the organization. We have a risk management, compliance, performance improvement team that are monitoring what's going on from a policy standpoint, a practice standpoint. We have our operations folks that communicate constantly. And then we have our supply chain folks that are really tied in. They work closely together. They're all very seasoned, experienced people. There's been very few things that I can think of that we said, wish we would have done that different. I feel lucky about that. But it really comes down to asking the question on a daily basis. Are we missing anything? Do we have access to the most up-to-date communication from our health department, from the state, from the Commonwealth, from the city, keeping our finger on the pulse there. And then we communicate with our sister, well, not necessarily sister facilities, but our peers facilities that are out there. What are they doing? We're paying attention to what other healthcare facilities are doing to make sure we don't miss anything. And then it comes down to just our execution. One of the great things about the team I have is they have relationships in the market. And so getting PPP from other vendors that we maybe didn't have relationships with now, but we had historical relationships with, has been critical. And that's sped up a lot of the important levers that we needed to pull to get the equipment and what we needed to get for our staff to keep them safe.
It sounds like that experience is a direct correlation with the ability for you to be able to move quickly, where maybe some other organizations don't have that luxury, if you will.
Yeah, I would say it's a combination of the experience and the close communication with the team, and knowing each other.
So, and if it's okay, Rod, I have one more follow-up question to that. So, obviously within our walls, culture is everything. It's something that Taylor, Rod, and I pride ourselves on, being culture junkies first, business people second. And part of that conversation when you're talking about culture is having a set of belief systems where everybody kind of functions around that belief system. I hear you say, it comes down to the communication of us always asking the question, did we miss anything? That to me screams, that's the culture of the organization, right? So especially with multiple facilities in different geographical locations where you're not meeting with maybe a corporate executive team every day, what is maybe, if I'm listening to this podcast and somebody has multiple locations and moving pieces like that, what are some things that you guys do or you have done in the past to maintain a specific type of culture and mindset where everybody's thinking that way?
So, I think that there's things that we want to hardwire, and what I want to hardwire is that the center of our strategic plan is quality care. And so in our business, our manufacturer is a clinician. It's a nurse, it's a psychologist, it's a social worker, it's a counselor aide. And so to create that shared vision where we're all rowing in the same boat, nobody can argue with our primary goal is to take care of patients and do it better than anybody else. And so that's primary. And then from there, it's trying to build a culture that values the people. And so we have a culture of accountability, a culture of recognition. And what that means is we celebrate the people that take care of the patients the best and take care of their coworkers the best. And we find a way through a merit-based system to say, you're going to get paid more. You are going to get an opportunity to grow. As we grow as a company, you're going to grow with us. And so it's creating that buy-in that I think is real and genuine. And you know what it's like to be part of a team. Taylor, I think you do. And so when you're a part of a team that's winning, man, there's nothing better. And so then the other things kind of just fall into place. People want to jump at the next thing that needs to be taken care of. I was talking to somebody the other day, and they were asking me, how is it that we never talk about schedules here? And I'm in a corporate office, so in a facility, it's a little different because you have to have everything scheduled out, and the nurses need to know what hours they're working. But here, I don't worry about what people are working from. Are they working hard enough, and I worry about, are they working too hard? Right. And so when you have that, all of the things that you're talking about, Brett, fall into place because you're hardwiring quality, you're hardwiring it's about people, you're hardwiring teams, and you start to get people that just know their role within each facility, and they thrive at being part of that team and doing that job.
Yeah,
I'll ask
yeah, go ahead.
Go ahead, Taylor. I'm sorry. Go ahead.
I was just going to say, it's almost like you referenced the experience of your team and how loyal you guys have worked together for so many years. It's almost like that, all that work that you've done leading into this, as far as building trust, building relationship, building culture, that allowed you to have this sort of speed and to get in execution mode pretty quick, rather than saying, oh man, this is going to be a challenging time. We really got to build trust and relationships so we can get through this. I look at all companies that face this pandemic and just say, what did the work look like before that? Were you prepared for, because that's not something you can do overnight. And that's certainly harder with these quarantine situations where, a lot of people were working remotely and challenged with their kids, and that sort of work as far as building relationships and experience, as you reference, seems like it's gone a long way for your success. So that's a parallel that I think really follows up well with your question, Brett.
That's great. Yeah, I was going to ask you, Geoff, you'll probably deflect, but I'll ask you not to deflect because that's how you are, and I love you for that. Do you feel like as a leader, it's inherently just part of the process, or true, or how you look at it, that it's just as important for your organization to buy into the mission and what you're doing as they are into buying into you maybe first? And how do you take on that responsibility? And is that something that is that something that's conscious for you, or is that just inherent?
I can't. It feels counterintuitive to me to think whether somebody's buying into me or not. Actually, I really don't think I care about that initially. You know, I think once I say what's important to me and talk about quality care, and my own personal story, which is I got into the field and I share this with all new employees, is I got into the field because my dad was an alcoholic until I was 12 years old, and then got sober, and I had a pull into the field from a personal story. And when you share that and you share your vision and passion for patient care, and you walk the walk in terms of how you feel about employees, and then they don't buy in, yeah, I think I do have a problem with that. That I don't necessarily, I don't know if I'm going to act on it, but trust is a two-way street. And so I am a servant leader, and I know that I'm going to walk the walk, and I ask myself, if I'm losing somebody, did I walk that walk? But if I think I did, and they're not buying in, they're probably not long for life on my team. We'll move on to somebody else. And because I do think that shared vision and rowing in the same direction is really important, because that's going to allow us to take care of patients in a better way.
No, that makes total sense. I'm sure that experience of, I've done this before, I've been in your shoes, that's kind of my origin, probably carries a lot of weight from top of the organization all the way to frontline, hands-on taking care of patients. I'm sure that experience on the micro is a filter you have all the way from leading on the macro. I'm sure that's a significant piece.
Yeah. So I will say, as a CEO of a facility, when I met Rod, I was the CEO of Friends Hospital in Philadelphia, which was the first freestanding psychiatric hospital built in the United States.
Wow.
So built in 1812.
Oh, that's crazy.
And it was.
We celebrated 200 years together.
Okay.
Yes, an incredible experience
just
to be part of it. The history was just amazing, a wonderful facility. But it was a facility that was in trouble. It was Quaker-owned foundation from 1812 to 2008. It was bought by a for-profit company in 2008, sold to another for-profit company. 2006, then sold to another one in 2008, and sold to another one in 2010. Had 7 or 8 CEOs in that period of time. So it was a culture that really was battered, and a lot of long-term employees, 20, 30-year techs and support staff and nurses, and they were really, really not in a good place, not trusting administration, not trusting the company. And one of the things that I leaned on was that I was a detox nurse. I started as a PRN pool nurse, and I worked my way up through the ranks. So I could speak the language, even though it was, I guess 11 or 12 years since I was even close to that. I still knew enough, and I still was passionate enough about what I did back then to be able to, and that did give me some credibility. It also, I think, allows me to have a lot of respect and appreciation for the work and how hard it is for them, but I could also hold them accountable, because I knew, hey, I worked overnights, I know what it's like, it's a little different, and so I could have those kinds of conversations, and it really was something that got a lot of buy-in from the teams. I was there for 4 years also.
Very
Geoff, and that kind of coincides. Something caught my ear earlier, that you've kind of within the industry and within the network have become to be known as a turnaround specialist, and that's a big deal, because that's a big job. And so I look at all the things that you've referenced about culture and about somebody buying into you versus buying into that shared vision, and also I reference, it seemed like both of your recent turnarounds, or maybe your most relevant turnarounds, were a 4-year period. So I don't know if that's an accident, coincidence, or from a timeline standpoint, how quickly, does it take for somebody to be able to gel and have that trust and relationship where you guys start to see a culture actually shift from a culture of 7 or 8 CEOs and a battered culture to, hey, now we're moving in the right direction? And does that create its own momentum? I know a lot of people who listen to this may be business owners that have dealt with that or will deal with that, and I think that'd be super valuable to talk about a little bit.
Yeah. So Taylor, thanks. That's a great question. You know, I actually think about that a lot. I was the CEO of 3 different individual facilities before I really got all my multi-facility. You know, I'm 35 across the country, and now I'm a CEO of a company, so it's a little bit different. But in individual facilities, I was at all 3 for 4 years, and I would say all 3 were in significant trouble. There was some real challenges. One of which was my first meeting with the city of Philadelphia was Geoff, you have to close this place.
Wow.
You know, and so
welcome to the job.
Yeah, we were never going to do
that.
They were diamonds in the rough, and we knew it. You know, and so, but I will tell you that I'm a positive guy. I mostly see adversity as an opportunity, and some of the worst things that ever happened to me turn out to be the best things over time. And I think nobody knows that better than you guys, you know. But I will tell you that my first 2 years of the turnarounds in those were probably the toughest years of my life. You know, part of it is you just care. You know, you want to win, and you want people to buy in. And when that's not working, it's really, really tough. For me, how I get through is just in strategic development, you know. So I look at, you know, strategy, culture, how do we measure our winning, and then the feel, you know. And probably the feel is what bothers me the most, you know. There's nothing worse than staff that aren't buying in and they don't believe in you. And I take that personally. And then when you coincide that with poor results or results that you don't think you're getting, it's really, really challenging.
Yeah.
I'm lucky enough to have seen it through in all 3 of those situations where we excelled, you know, and we went from very, very low expectations to, you know, near the top in a benchmark situation. And so I was able to see all 3 of those through. And now I'm kind of in the same spot, and I'm in that same sort of rhythm. I think that for me, you know, it's about timing, creating shared vision, and understanding your team and how hard you can push them to get to where you want to go, to get the results that you want, and the benchmarks and goals that you set. And it's really, really challenging when you can't get there today. You know, so what I do is I spend a lot of time thinking about my strategy, and I always say I want to think about the end. What does this look like in the end? I imagine what the facility's looking like, what the organization feels like, what the staff experience is, what the patient experience is, what the patient satisfaction looks like. What are all the measures? What's the data look like? And I spend a lot of time thinking about that, because that ultimately informs what I do today. So
work backwards.
Yeah, exactly. So I can feel the wins in micro steps, so to speak, even though the results aren't where I want them yet. And I think that's been a very healthy way of me dealing with, I don't like where I am today, because I have a sense of belief of where I'm going and what my goals are. I do. There is part of me, Taylor, that wonders what it would have been if I stayed, you know, at Fairmount for 7-8 years. What could I have done? I feel like I didn't quite finish the job. But then there's another part of me that feels like, you know, once you build your team and you have a competent team, you know, the first year, every decision you make, you're a genius. By the 4th year, it felt like every decision I was making didn't quite turn out the way that I want to, you know. And I think that's I take that as a good sign in the team that I put together. But I wonder if it would have been even better going another 4 years, or if I would have actually hit a wall, you know. And so that's a question I have.
Perspective.
That's funny, because I literally just wrote down, and it's a perfect bridge to this question, Geoff, is I think it's easy to lead when things are good. You know, you know, it's just there's a certain level of maintaining that is different than being in an adversity situation. And given your background with these turnarounds and these situations, and, you know, your own corporate crises, if you will, to come in and fix what's there, or to make it better. Has the pressure or the environment of coming into a situation like that become something that is normal to you? Is it something that you feel like your personality just thrives in? Talk to me about that, because you've gone through multiple sequences on multiple events like that, where most leaders would have one or two of those in their entire careers, and it would leave a big scar. Talk to me a little bit about that.
Well, I won't say I'm not scarred in some respects.
There you go.
But I will say that I feel a pull to jump in when things are a bit of a mess, So I see, another facility in the market that's really struggling, secretly at 11 o'clock at night, I wonder if I'll do that one someday, and it's because I think I've grown so much, just in how I feel when I do that job. And I think it's keeps you on your toes. It's, I think, healthy in a lot of respects. And I don't want to get complacent. And I want to continue to grow and learn. And so when the facility's in real trouble and on the verge of, well, maybe not closure, but maybe not creating a healthy, sustainable situation, it's not good, and it's not good for the market, for the community, for the patients they serve, for their staff, and I feel a pull to jump in and help out.
Do you think that's gotten easier? Like, I just think about, any one of us go through situations where we deal with something for the first time, and it's this big event. We've never dealt with. There's a significant amount of uncertainty. And when I hear adversity, I hear uncertainty, right?
Yeah.
How much, I don't want to say the word easier, but more, maybe familiar is a better word. How much more familiar has that been for you by doing it multiple times? And maybe what's one piece of advice you would give somebody who's dealing with something for the first time? But if you could go back to your previous self when you dealt with this for the first time, what would you tell them now that you've done it multiple times?
Yeah. So I've been in that situation, having, in multi-facility leadership. I mean, a facility's in a different state, you're hiring a CEO and you're doing it through them. So my best advice to them is to learn as much about the organization as you can before you start pulling triggers, and so I would usually give somebody a 60 to 90 day window to go in and assess and learn, and not to do anything, not to change anything, and to just learn as much as you can about your team first. And then start to learn as much about the staff, and then look at the staff through your team's eyes and see if you agree. Do you trust their assessment? Are they seeing things the right way? And so that's really the core of the culture. But then the data will show you the strategic answers to the facility, and you really have to tackle both. You can't necessarily fix the strategy if you don't have the right people in place necessarily, but you can inform yourself, and that'll help inform the decisions that you're going to make with the team. But I think that's what it comes down to, is that assessment and learning period before you start. And then instead of forcing change, you look for opportunities for the change, and I think that's another big thing is, I would say to my wife sometimes, I feel like I only work 6 months out of the year, because the other 6 months is tedious, monotonous, and we're working toward the opportunity to change, but the facility might not be ready yet. And so now I see an opportunity where we're ready. An opportunity comes my way. Now we're going to pounce, and now it's almost manic 6 months of change that really gets you there. And so I think it's really understanding, again, that for me, what I do is I create that vision for the end, and I look for the opportunity to make the change. I don't know if that's a good answer, but that's kind of how I approach it.
I want to follow up kind of to all of this, and I love the direction you took, Taylor, with Geoff, with the turnaround specialist. So Geoff, you mentioned turnaround specialist, and then you referenced the team and what teams do. I mean, good teams win, right? And if they don't win, then they don't remain teams. But one thing that you said that has resonated with me, and what I'm interested for the listener, is during those periods when you're first turning around and you're looking at all the things that have to be done, those teams, they're not going to win right away. Right? You know what I'm saying? I see you nodding. It's like it's going to take a minute for the strategy to be built. It's going to take a minute for the implementation to kind of commence. So during that period, when the team's not necessarily winning to the degree that they will, what's the messaging then?
So, I think in managing my team and knowing my people, the little things matter. Little things matter, And so if you have a team that's really engaged and committed and used to winning, and they're struggling and they're not getting the results that they want, you find the little wins to celebrate. You start to shrink down the goals to make them a little bit smaller, to make them a little bit more incremental. And you start to celebrate those wins so that you look for opportunities to give the positive feedback. I'm a big believer. I read Drucker's books, and if you read Drucker's books on management, they're like this big, But my philosophy over the years have been drilled down to three things. If we teach our managers how to hold people accountable in the right way, have difficult conversations that come from the heart about really improving a situation, someone's performance. If a manager can do that, they're going to be solid. If they recognize good performance and they can do that in a way that's meaningful, eye contact, and hey man, you really did that, then you're going to make a real difference with that patient. You're going to make a real difference in that patient's lives. You really helped out with that staff member who's really struggling in that moment. If you can have meaningful recognition, meaningful accountability, and you can delegate and follow up, you're going to be a good manager. And then when you have it and you break it down to that level, as a senior leader, when I see someone doing that, man, there's lots of things that you can celebrate. There's lots of things that you can help them feel the win on.
What a cool answer.
Yeah, that is cool.
I'm writing.
In basketball, we would always talk about making the game smaller, right? And so you had this 40-minute game, you had the prep, you had the post, but in the moment, what can you control and rally behind when you don't have momentum? Because I think once you have momentum, that's a different story. And I think that's what you mentioned about opportunities. Then it's like all hands on deck, and you're shoving the ball forward. But in basketball, we would say shrink the game and make it a possession by possession.
Yeah,
and just go win one possession. When I hear that about how you lead, it's when there's an unknown and when you don't have momentum, make the game small, celebrate the wins, have the conversations, and then when that opportunity comes, that's when we'll throw gasoline on the fire that once it's already fueling. So that's really cool.
It's a great way to put it. I love it.
Always got the B-ball.
I was just gonna say, man, just like he's calling the game for the Knights on the side of the court.
I can't help myself. The fact that I don't have a whiteboard back here is a whole nother issue. But
there you go.
So Geoff, I got a funny question for you. Not a funny question, but maybe a little shift in topic. What's the one thing you're looking forward to most when this when this whole environment just kind of relaxes a little bit? What's the one thing you can't wait to do?
I have a 24-year-old and a 22-year-old. My 24-year-old's a registered nurse. I also have a 3-year-old, by the way.
And I want to interject. I want to interject that 24-year-old, for everybody listening, has been on the front lines of COVID at Ground Zero, serving at a high capacity on a COVID ward. And shout out to Katie, right?
That's Isabella.
Isabella.
Katie just graduated from college, and and I just haven't been able to see them, and it's the little things, right? And I just miss them like crazy. Luckily they're coming over this weekend, and we're gonna watch a movie and outside, and we do our social distancing kind of thing, but just to have a little bit of normalcy around just being able to socialize with your family and people that you care about. I miss my friends, that's really it. I wouldn't mind getting on a plane and taking a trip somewhere, but right now it's just maybe just more just see people I care about,
I echo that, man. It'll be good to be able to come visit.
Yeah.
Yeah, no kidding.
If you guys are okay, I have one more question that resonated with me from a little bit earlier. Is that okay if I throw another question out there? Geoff, you mentioned you work in a high burnout environment, right? What are some of the things that you notice about your providers that are teetering on burnout, and what are some of the things that you suggest, or how are your directors or lower level management or managers at that point, how are they empowered to notice that and provide some relief?
Yeah.
Great question.
So Rod, I'll tell you, we work in an environment where and when I say we, it's not me. I don't see it day to day, but our counselors, our counselor aides, our nurses, they are dealing with patients that experience a very high degree of trauma in their life. And to hear those stories day in and day out, and to see the devastating effects of it, in a way, those folks are my heroes that do that on a daily basis. Now, I know what that is. I probably did 5,000 level of care assessments with people coming into treatment before in my early career, and it wears on you to see the pain in people's eyes. And for me, what I try to do is to celebrate every letter we get back from a patient that says, "You guys changed my life." But I also recognize that it's not for everybody to continue to do for 20 years or 30 years. I'll use in an acute setting, a social work position. Very challenging position where they have to do the level of care assessments, they have to do therapy, they have to do one-to-ones, they have to do psychosocials where they're doing assessments on folks, and all the discharge planning, and then say goodbye, and then you're talking to the family. And a lot of times there's very high conflict situations or really sad situations. And so there's just a reality to those positions that it's just really challenging. And so we want to try and create a culture that supports it, that recognizes it, that helps folks deal with it. But I'll tell you, when that social worker is ready to move on and they're a good quality employee, I'm going to try and find a position in utilization review where maybe they're clinically really strong. They may not be having to deal with the direct patient care all the time, but they're still making a positive impact by talking to the insurance company about the clinical care, or maybe moving to admissions where they're doing, taking the call from the referral source. And so I think that really comes down to just an awareness. I think too much in our industry, there's not enough emphasis on the impact of care on the staff that deliver it.
No question.
Yeah, and so we need to continue to look at, see how we can drive down turnover and improve the experience that they have. And when they start to struggle with it, we're there to intervene and try and help support them in that, dealing with it.
I remember from my time working in the behavioral space, albeit our specialty was primary care, but I got to see a front row seat through you and your organization, your teams. Really such an underserved sect of healthcare, right? Mental health is just an underserved section of healthcare. And I know that there's such a push to raise awareness for all the different disciplines, if you will, for lack of my better word, of all the things you guys take care of in behavioral health as a whole. So it's always blown me away with a huge level of respect and really not, doing my best to not take that for granted, just how valuable the services are that you guys provide. And you may be at a different company, running a different company, turning a different company around now, but I know that the way you operate and the way your teams operate, there's, those applications look very, very similar. So that's something that we have a lot of respect for.
Thank you.
Yeah, it's super parallel to any industry. I hear, medical services and all these things. I'm just thinking, for any business that's belly to belly, for any type of fulfillment, that is a great question and a great answer. Having that awareness and having that pulse on that frontline team is just critical.
Yeah.
And I love that strategy, right? It's about the person, not the job, is what I hear. It's about, okay, well, maybe there's another opportunity to be able to you're serving them just as much as you're serving the end user, the patient itself.
True.
So that's just a pure testament to everything that we've talked about in the last hour, man. So Geoff, every time we sit down, it's amazing. I learned something new. So
thanks, Brett.
Great.
Appreciate that.
Yeah, man.
Had fun.
Definitely, man. Geoff, it's I echo Brett, man. It's anytime we get a chance to talk, and I know we talk frequently, but when we get in this setting and you get a chance to just kind of go, it continues to impress me and certainly have a huge level of respect, man.
Well, I greatly appreciate it, and I really appreciate the partnership, too, as you know, and learned a lot from you guys, and I know we'll continue to do that. So
that's awesome.
I obviously echo these guys' thoughts and notes, and also Geoff, as we wrap up and we honor your time, is there anything that is on your heart, on your mind, and you would encourage us, the listener, or whomever? During this time, you said you're a positive guy, and you certainly borrow from that, given what you go through and what your staff is going through right now. If there's anything that's top of mind, I'd love you to share before we wrap up here.
Wow, I guess that's a hard one for me, because I don't feel like I can teach anybody anything or have any. I don't know. That's a tough one. I guess maybe. I just wish everybody well. It's a really challenging time right now. People are really stressed with COVID, with all the things that are going on in our society. No matter where you land, it's really, really challenging. And I genuinely believe love is the answer, no matter what. And being positive and helping to solve problems. And, I'm going to do my part in that. And I know our company is going to do our part in that. And I know that Urban Young's definitely going to do their part in that.
That's awesome, man.
Appreciate you.
Awesome.
Well, good stuff. Well, thank you guys. That was fun.
Yeah, Geoff, thank you so much for your time. Always a pleasure. And I'll be downloading with these three gentlemen about the notes that I took today and what we can borrow from you to instill in our business. So I know anybody listening to this is going to get a ton of value out of this conversation. So
absolutely.
From all of us at Urban Young and especially down here, we just want to say thank you for your partnership too. And you guys have been a big impact in us since we've been able to serve you. So
that's great. Well, you guys have a great day, and thank you for having me on.
Thanks, Geoff.
Thank
Appreciate
you
it.
so much.
Take care, guys.
Take care, man.